Welcome to the Lovely Important Nonsense Podcast. It's your boy Matt. Somebody's hitting me up. Spelling. I just like doing that part. I scream as much as possible. I'm not gonna go that high again. We are at the Lovely series, and we're talking about mental health. Please, my two guests here will introduce themselves. Start with you.
My name's Tito.
My name's Stephan.
So, and why are we here today? So let's what is your title and what is your title? Like, what do you do for a living?
So, I am a substance abuse counselor.
Awesome.
Yeah.
Thank you for saving me there. I was tongue tying like hell. All right, go ahead. Substance abuse counselor.
Yeah, so I'm a substance abuse counselor,
Uh-huh.
and right now I work more in care management.
Mm-hmm.
So, as an addiction counselor, you can work with clients in a lot of different ways. You can work with them in a setting where you see them every day. You can see them in a setting where you help them on a monthly basis with different issues with that they may have with their recovery. And right now, I work for a program. It's a Medicaid funded program that takes clients who may be more susceptible to going into emergency rooms because of overdoses, people more susceptible to having to go into detox, people who have a lot of problems with their drug addictions that their insurance companies see. They give extra services to them. So I'm one of those case managers who helps facilitate those services to get them out of the hospital, to get them clean, to get them to get those resources that they need.
Got you. And you yourself, battled mental health also.
In a way, I went through it for the last 3.5 years because my brother passed away. So
right. And
it's something that affects everybody. It just depends on the level.
Mm-hmm. So I brought these two. I wanted these two on because I wanted to speak a little bit. I want to go into depth a little bit more on how men approach mental health and how to deal with it. Honestly, I'm kind of slow when it comes down to like mental health stuff. Like I'm trying to learn as much as possible. So I like to bring on people who have done or people who are in the field, and I like to speak to them and ask them different questions. So when you were when I'm going to speak to you real quick, when you was dealing with your mental health, and you said your brother passed away, I have also dealt with loss, and especially as of recent, as of like yesterday, I've also done with loss. So how do you deal with the feeling of the void?
That's something that it's complicated to really explain because it's
What was your method though? Like, what was like?
Honestly, I just surrounded myself with work. Yeah. That was the only thing that could distract me, was continuously working. No breaks, no vacations, no partying.
Right.
So that kind of just, you get so caught up with work that the pain just becomes numb.
Mm-hmm.
You do cry. I used to cry. I used to cry in front of patients. But
and what field do you work in?
I do non-emergency medical transportation.
Okay.
Yeah. So
you'll just have breakdowns out of nowhere.
Yeah, and it's embarrassing because people don't know you and they're looking at you, and it's worrisome. But I didn't have any time to grieve because my brother passed away December. My father went to jail January, and then I became the man of the house within a couple days. So I didn't have any time to. But it's not, you can't really deal with the void directly. You just learn to accept it.
Okay.
And try to be better.
Now, how in your specialty, because of situations like that, do you see a lot of patients and clients, or I don't know what you guys call them patients?
You can call them patients. You can call them clients.
Okay. You see a lot of just people who come and they suffer something that Tito suffered, and they end up getting hooked, or like how do let's just say, how do we stop that happening before it happens?
You see that's a very loaded question. You know why? Because
it's a loaded podcast,
and it's a loaded question because the answer lies with the person. You feel me? Right now, you went through 2 different traumas. You went through you went through 3 different traumas. You went through the trauma of losing your brother because your brother passed away. A piece of your family, of your immediate family. You lived with your brother?
Yeah.
he passed away. Was it something sudden? Was he sick for a long time?
My brother actually had a heart attack.
Wow.
So it was something out of the blue. It was something that you couldn't even mentally prepare yourself for.
Yeah.
And then after that, just so happens your father goes to prison.
Yeah.
And that's another shock. That's another blow. When you go to prison, that's almost like having someone die.
Yeah.
You know, my father went to prison, and it was like for 5 years, it was like he didn't exist. And I remember being very small, having to deal with that, and not really understanding that. And even though I was 5, or even though I was 4 years old, nobody really talks to me about that, right? Imagine someone who's an adult.
Right.
Who's just they're thinking, oh, he's an adult, he's a man, he should just be able to deal with it. No, he shouldn't just be able to deal with it. Right. Because nothing in life has prepared him to deal with that.
So should there have been like, how do we get men to start talking? How do we get them to like, it's okay, like we have women groups. We have it's okay for them. You know what I'm saying? It's like, it's supposed to be okay for them. But for us, it's almost like looked down upon, you know? So it's like, how do you get a guy, or he's just a strong man, you see him, he had to step up out of nowhere, right? So you know how it is. You got to become the man quick, right? So you don't have time to be trying to, how do you tell a guy like it's okay, man? Like you gotta find like, or find a place for a guy to go.
Well, first of all, you have to be able to make sure that when you do start having the conversation with that person, that they're open for dialogue. Right, so you have to make sure, for instance, maybe someone could tell you to throw out the garbage, right?
Right.
But it depends on who's going to tell you to throw out the garbage.
And how they tell you.
Exactly.
I know.
Right.
I know that.
Yeah.
I know that there are people that if they ask me, "Oh, Stephan, could you throw out the garbage for me?" I'll be like, "Okay." And then if I'm like, "Why can't you throw out the garbage?" Because it's just that person. Because you have that dynamic. Because you have that relationship with that person. So if you hear somebody telling you, you know, what's your name again? Matt. Sorry, Matt.
It's all good, Matt.
You know, Matt, I think you need to go to therapy because you know I'm seeing this pattern and that pattern in your life, right. And you know, I think that maybe it would be better for you to look into maybe why you do the certain things that you do, you know, because I'm seeing that this is impacting your life in a negative way. If somebody who you know and you trust tells you like that, then you'll be able to trust them with whatever it is that you're going through. Unfortunately, men, especially men of color, and you know this, we come from generations and generations of oppression. We come of generations and generations of trauma. We come of generations and generations of people telling us that we're not good enough.
Right.
Of generations and generations of people telling us that we shouldn't hold the same space as other people do. We have to deal with all that. And we have to still keep trudging forward, and we have to keep working, and we have to keep supporting our families, even though a lot of the opportunities that other people have in the world, we don't. But nobody takes that into consideration with men. You know, men are supposed to be the providers.
Yeah.
You know, men are supposed to be the strong people, but when the foundation isn't strong because certain things aren't being addressed,
right?
How can you expect a man to really be a man and really what is it called? And really overcome these obstacles?
Yeah, I like what you're saying there. I want to come back to that real quick. Tio, I wanted to ask you a question. So when you, like he was saying, we have to find people. Was there someone there when you were going through your problems, or? You
have people that you feel you can have those type of conversations with, but it's like you said, it's somebody you have to confide in.
Okay, but did you feel yourself kind of getting like more restrained on what you say and how you say
yes. it? Depends on the dynamic that you have with that individual. You know, like for instance, Kat to me is my big sister. So she was somebody I confided in my darkest moments, you know, and I could say things to her that I might not say to Matt.
Right.
Because Matt isn't going to understand. Because
from that personal level.
Yeah. Or, you know, and you have people that have their own situations that they don't grasp what you're feeling. So they're going to give you their perspective on the situation and not take into consideration your own beliefs or what you're really going through. So you can find people, but again, we're talking about men. It's hard for a man to open up to another grown man and not feel like he's vulnerable. because that's what we're raised to believe, that we can't be vulnerable.
Is it like we're not vulnerable in front of other men because of like a power dynamic type of situation?
Yes.
All right. I could feel that. I can understand that a little bit.
It makes you look weaker.
Yeah. No guy wants to look weak in front of another guy.
And this is something that even your mom does. Like, you fall, you cut your leg. Oh, don't cry because you're a boy.
Right.
You know what I'm saying? That it's instilled from a young age that we're not supposed to be weak. We're not supposed to show weakness.
Right. You're definitely right on that. So, okay, let's say if there was a gentleman who was, I don't know, you probably run into this a lot. He's alone in the situation. Okay, and that's usually when I was reading up on, because I had to get prepared for this. So when I was reading up on, like, there be gentlemen who are alone in a situation, or maybe they feel alone in a situation. That's usually how they end up turning to drugs, alcohol, or sex, or whatever the addiction that they end up having. So, I was always wondering, like, okay, before that happens, like, is there a way to capture them or capture their attention, or is there, like, do we have to it's just something like, or is it what I hate to believe, that a guy has to come to terms with it himself before he can make that decision to, like, get help?
You always have to come to terms with things yourself first.
Yeah, you always sometimes want somebody to pull, like, to take control of the situation and throw you into something, but I get it.
But you see, until... This is my opinion. And, this is my opinion because of the way I was raised. Mm-hmm. And this is my opinion because of the work that I do, that I'm like, okay, you know what? If you see that someone is in a crisis, if you see that someone is going down a path that they really need some guidance to get back to where they need to go. It doesn't matter if you're depressed. It doesn't matter if you have an addiction. If you see that there's someone that's going through something, and they're not willing to at least acknowledge that something's not up, you can't help them.
Right.
So, but you need to, as a friend or as a relative, as a brother, as a sister, as a partner, you need to be able to, of course, know those warning signs. And New York City has a lot of resources. If you Google NYC Department of Mental Health and Hygiene, they have resources for mental health first aid courses, which are basically like these courses where you get to look at the warning signs of someone who may have symptoms of depression, warning signs of someone who may be contemplating suicide or having homicidal actions. There are resources out there on the internet that you could look up.
I've never even heard
that can
before.
Help you become more literate about mental health, and it could give you a little bit more of a verbalization for the things, because us naturally, we know when something's up. You know when your best friend is going through something. You know when your mom is upset. You know when your dad is upset. You know when your brother, your sister's upset. You know when your best friend is going through something. That's not mental health. That's just being a person. You feel me? So mental health just helps you verbalize it, and it helps you get kind of like a pathway to understanding yourself better, And once you resolve all those issues, then you're a happy person. Right. Then you're a satisfied person. You feel me? So that's what we need to do as friends of people going through crisis. We need to encourage you. You're going through this right now, but if you open up and you're willing to talk about your problems, and you're willing to talk about and find the solutions to the things that are bothering you, that are going to help you, be better, then you're good. Right. But men, we didn't want to accept those kinds of things. We were like, oh, I could do it, I'm fine. And then you're, in the gutter, and you're like, oh, I'm not fine, but I can't tell anybody because I have to figure it out myself. I'm a man,
Right. On my travels, I ran into a lot of different, like, homeless people, because when you're traveling around, I wasn't homeless, but I was on the move. So when you travel around, you do run into these groups of, like, homeless or things like that. And that was a big thing in the homeless community. It was like men who just couldn't accept the fact that what they did failed. You get what I'm saying? And how they handle it failed. And they ended up in a situation, of course, they make a lot of excuses. Everyone's drinking, and they're just trying to drown out the sorrows and the pain, except for just getting back on the saddle and just just getting back on the saddle. So what happens there? Like, is that just fear? Just the work? And
there's so many things. There's so many things.
Yeah.
Think about it.
Mm-hmm.
Personally, I'll tell you, when I became independent,
Mm-hmm.
you know, when you're independent, you struggle. You feel me?
Yeah.
You have to pay rent. You have to pay. I mean, I live in New York City. I gotta pay rent. I gotta pay Metro card. I gotta pay for food. All this stuff. And in the beginning, it was very stressful. And I wouldn't ask my mother for money.
Hell no.
Why would I ask my mother for money? So that she could be like, oh, Stephan, you need help. No. I'm fine, right? But
right.
There were times where maybe I did need money, right? And because I was so worried about looking like I failed, or looking like I needed help, or looking like I was weak, and then having to have my mother fix the situation, there were times where I was freaking struggling without having to struggle. When I had my mom where she could help me, you know, because of pride,
right.
Because I wanted to feel some, you know. There are people who have even worse dynamics with the people around them, with their families, with their friends,
mm-hmm.
that they could be battling a life-threatening illness, and they wouldn't tell anybody because they don't want anybody to feel sorry for them. They don't want anybody to look down on them. They don't want anybody to be like, oh, good. You know what I mean?
Right. I get what you're saying.
And that kind of mentality is very, very self-sabotaging, because humans were social beings. You feel me? And even if someone can't help us solve a financial issue, or even if someone can help us with something, someone could always just be there and be a sounding board for us and help us know that, you know what, even though we're going through something, we're not going through it alone.
Mm-hmm.
And that's why you see a lot of people who live in like big cities committing suicide. That's why you see a lot of people who don't have those very strong connections, those very strong circles, that feel isolated. They commit suicide,
right.
or they just disappear, and they disappear into their addiction. You know?
Yeah. I could definitely understand and relate to some of that. So who was a big factor in your life? I know you said Kat was a big factor, but who was another big factor, and what did they do to help you get through the agony you was going through?
I had a couple of people that would constantly check up on me. One of them is one of my best friends from high school, who has his own family, his own situations, but he understood that I needed somebody in my corner. Same as Kat, you know. It goes a long way to get messages, to get phone calls, because people don't understand the value and the weight that has on somebody who feels like they're by themselves. You know, part of the motivation was just my brother. You know, a lot of the dreams he wanted to accomplish. I also have a nephew. That pushes you whether you want to or not, because you don't want to be a failure. So it stops being just your purpose in life. It's no longer just for you. It's also for that child and for your brother's memory, or whoever you lose, you know. And then my father, right. Because, you know, like he says, it's true. When people go to jail, it's just the same as if they died, because the only people who suffer are their immediate people that really care. You know, you have family members that won't write, don't put commissary. So understanding that me giving up on myself was going to do worse damage to my father kind of also boosted me to continue to go forward.
Now, I know you said you had two, you actually had a male and a female who was in your ear helping you guide through. Now, was there a bigger difference between the male and female guidance, or was it about equal to you?
In my case, I don't, you know, like support is support,
right,
you know, and you see, and depending on the relationship you're at with the person, obviously, some will have more weight than others.
Right.
But it's at the same time, it's different type of advice that they give you.
Well, you could test for this. There's a lot of men who have a bad relationship with other men, right? So they will never. It's
ego, though.
You know, yeah,
the macho.
Sometimes, yeah. Well, we don't know their upbringing, whatever. It could be a lot of ego into. And then you'll see them. They'll look like the little boy that needed a role model. You get what I'm saying? But of course, they can't do that now. They're 30-something, 40-something, 50, whatever it is, right? Like, is it because that's what I was asking you, like, which one held more weight? Because, like, was it more of okay, a guy said this to me, so I feel like I should be a little bit more stronger, or a little bit more discipline in my approach to my health.
I'm gonna tell you something personal that I don't tell a lot of people. Some of the people that were closer to me, like blood, my mom, one of my male cousins, instead of them giving me positive, advice, like if they saw me crying, they would complain. Oh, what you're doing is wrong. You look weak. You make your brother feel bad that, you don't want to let him go. You don't do that, right. Because you don't understand my pain. Everybody processes grief differently, and it should never be downplaying how they feel. Try to understand why I'm crying.
Right. So if someone process something like in a toxic way, like he was saying, and of course they're going to try to pass that on upon their children or whoever could listen to them at that time. How do you separate yourself from that, especially if they're as close to you as like his mother? You get what I'm saying? Your mother's in your ear. You're going to listen. You get no matter what. But she might, like you said, you might be processing her grief in more of a toxic way for you. So how do you know a strategy just to get away from it, or you just got to recognize that like this is happening and you just pull yourself out that situation? All right. But then again, is that also being the man who walks away from a situation because it's too tough, that we was talking about earlier?
Yeah.
So like, how do you make the right call there?
It's tough. It's tough because it could be misunderstood, because you can stand up and tell somebody you're wrong for this. And it's like you said, they're taking their grief and enforcing it toxically to you. And it's because they're going through pain that they don't process. So it's a lot of factors to that, because people don't acknowledge mental health. And like you said, there's little things that people do that you need to understand. My situation got worse because my mom and my relationship dwindled because of that, because both of our grief, it's not there. The communication isn't there anymore. And it sucks, I'll be honest. But you don't expect people that are that close to you to make you feel bad about what you're going through, when you really need somebody to make you feel better, or at least make you understand that they understand.
Right.
And accept that you can be weak, you can be vulnerable, because you're only human.
You don't think what is your take from it?
You see, he said a lot of truth right there. I felt it. And what he said has nothing to do with being a man. It has nothing to do with being a woman. It has something to do with being a whole person. And that's the point.
Right.
He is deciding, the situation isn't what it's supposed to be, but he's deciding not to let that take over his life and take over his head. And someone like that has a good chance of not letting the problems overtake them,
Right. Okay. Well, great. So now let's touch on some of the, like, we got the guy by the fire. He's not dealing with his issues right. His issues were probably, I don't know, let's just say 20 years old or something like that. All right. It's been molded inside of him.
Oh, you said something. I'm sorry. You mentioned something about the parents and the kids, right? About
yes.
I got to talk to you about that, because that's very important.
We're gonna touch on that.
Okay. No, because I feel like I didn't think we addressed that.
No. We're gonna. I got me. You got something else coming up.
Okay.
So,
no.
There's certain specific things we got to talk. But yeah, I wanted to ask him because I just wanted to go real quick into that, because like he said, he was going through a situation with his mother, and of course, mom and son.
Moms are just
you
they're the best.
Can't really ignore your mother, even if no matter what, however you feel about it. So, but
I love my mom.
Try not to pick up the phone. You get I get like 30 calls if I don't pick up my phone.
If she sees this, she's gonna say, Stephan.
But you went through the situation. It's been like how long? 3 years?
It's 3 years and some change.
Okay. And I believe it never gets easy, no matter what.
You adapt.
And I understand.
Yeah.
So but so how are you today? Like, what's going on? Since that moment, since those days, like, how did you pick up those pieces that were broken, put yourself back together, and keep pushing forward?
What helped me was the loss strengthened my relationship with my father.
Okay.
So my father in jail did a lot of reading, and came back with a different mindset. So my father always tries to instill positive thoughts in me. You know, he pushes me to do things for myself. He wants me to stop being so selfless, which was one of my biggest issues. So now I'm better. You know, I got surgery almost a year ago. I've been losing some weight.
Congratulations.
And I started doing things for myself. You know, I understood that I needed to live more and not sacrifice myself for people that I felt I needed to.
Right. Definitely.
Yeah.
Definitely. Like, I also realized, like, it seems like a lot of these shows that I'm doing when it comes down to this mental health or anything, it always comes back to education. It just seems like everyone's a little bit better when they read a book or two, you know? And it does, I think, and me, I feel like if you're going to take anything from this and you are struggling, sometimes pick up a book. You'll find a hero in the book. You'll find something. Maybe pick up
somebody you can relate
book,
to.
Something. Someone's going through something close to it, or, you know, it don't have to be exactly what you're going through, but it could be close enough that you could grab a hold of it. And then again, a lot of my friends or people I used to know that do go to like prison. You know, you get an extent, and I did a little stay. But you do get a stint, and you do got time. So
a lot.
You do come out with a different mind if you spend most of your time reading.
Yeah.
You know, that library come in handy. That library comes in real handy. Do you see in your profession, like, when you tell one of your clients or your patient that, read something or pick up a pamphlet or something, do you see them come back with better attitudes when they do start to educate themselves a little bit better?
So I'm going to tell you something. I love reading. And before I did the job I'm doing now, I worked in a center with all addicts, right? And I tried to start a book club. It didn't work. But what we would do is we would do these wellness days. And instead of talking about books, I would put YouTube videos about different kinds of spirituality, about self-help, self-empowerment, understanding trauma, understanding family trauma. I would put things in like that for them because it's a little more interactive. It's a little more fun. It's a little more user-friendly. You're not flipping pages and having to have glasses to look or having to look at a computer screen. You know, I think looking at interactive things like that is much better to deal with.
Okay. I didn't think of that. What did you educate yourself when you was going through things, or was it just more of like you was just getting more spiritual conversation?
I read a couple books that my father recommended. Because it's true, like you said, education about certain situations help. You know, you understanding what the problem is. You know, you understanding your own warning signs.
Yeah.
Because a lot of times you going through something, but you don't realize it. To you, it's just I feel I don't feel good today. You know, I'm not in a good mood. People don't want to understand it. So I think, like you said, is right. They should educate everybody on mental health, on any type of situation, so that people can understand it.
Is mental health pretty much a new conversation that's happening?
No.
Like, I don't really remember.
It's something that was just always overlooked.
Well, you know what? Can I tell you something? Mental health is changed. The focus of mental health has changed.
Okay.
Before, to get trained as an addiction counselor, you would take a lot of classes, of course, about toxicology, about different kinds of drugs, about the different kinds of effects that certain kinds of drugs have on your body. And now the training for substance abuse counselors is more about, and the training for psychologists is more about trauma-informed care. It's more about family dynamics. It's more about, overcoming social determinants of health and wellness. So mental health is becoming less theories and less protocols and less clinical observations, and it's becoming more about, okay, we're going to take one person and we're going to look at all the different aspects of their life, all of the different things that can affect a person, and we're going to try to figure out what things around them are making them behave the way that they are that isn't helping them.
Right.
And before it wasn't that. Before it was like, what chemical in your brain is making you the way you are? Or
they used to give people, what's they called? They used to cut open your brain, wasn't it?
They used to lobotomize people.
Lobotomy. There you go.
They used to take people who had bipolar disorder because maybe they got raped or something, and they developed a mental illness, and because somebody was a victim of sexual abuse, or because someone was going through a neurotic episode, or because somebody was having an issue, they would just crack open their skull. And drip, or
give them electroshock therapy.
Electroshock therapy was a one too. They used to put probes on your head. What was another one they used to do? Crazy stuff. Yo, science is crazy.
Science is crazy.
Science is crazy. It took all that for them to realize maybe we should just talk to them.
And sometimes you just need to talk.
Yeah,
let's just talk.
That's the truth.
Look at you. 3 years later. Look at you. You right now are probably so much better than how you were before.
Yeah. No,
100%, right?
100%.
You probably feel.
I'll be honest with you. I only hear good stories about you. I'm not gonna say it. I'm not even gonna try to.
That's good. That's good.
That's a good thing. I only hear good stories. And they to give cat can talk. Cat tell me if someone's bad, they bad. But yeah, I only heard good stuff. But yeah, definitely 3 years later, look at you, doing great. I like this.
And it's all because of you. It's because you made the choice, because you made the choice to take your mental health into your hands and take care of yourself, and you're the better man for it.
Yeah. To touch about what you said on, what we can do, or if reading a book can help a person that's struggling with addiction or mental health, one of the biggest things is who they surround themselves with. Because let's say I'm an addict to oxys. He prescribes them to me, but he does it in a controlled situation because he's trying to get me better. Mm-hmm. But if as soon as I leave his office with my pills, I go chill with somebody who has their own pills, I'm not doing anything for myself. I'm just going to continue the cycle. Right. And that's one of the biggest issues with mental health and substance abuse, that people stay in the same environment. They don't try to leave it. So you're always going to fall back on it. So you will have to sever ties with certain people, because if not, you're going to repeat history.
That was going to be another thing I was going to touch on, the ties with others.
Mm-hmm.
And like you said, there's just sometimes there are just not good people around you. They're not dealing with it the same way you're dealing with it, or they're not feeling it the same way you're feeling it. And your surroundings will mess with you. Let's just say, okay, you were smart enough to be like, okay, mom, we got to back off for a little bit. What if someone's not smart? Like, it just comes down. I know I got a lot of what ifs, but
that's
and it
reality.
comes back to like they got to make that decision themselves. But like, I'm coming from a place of, let's just say, someone who don't know. I don't know nothing. So I'm in the office. I'm just asking, like, what if I'm not smart enough to do that? What if I don't know who's damaging and who's not damaging? I'm just listening to the people I usually always listen to. Like, how am I supposed to like connect the dots here? Like, how am I supposed to do this?
Life will happen.
Big facts.
And life will make and life. Listen. Mm-hmm. Most of the people who go into therapy they don't sign themselves up for therapy. Somebody either forced them, or they had a nervous breakdown or a suicide attempt or something like that. I'm not saying that that's always the case. And there are a lot of people. This is why you see so many people committing violent crimes, and this is even why you see so many men raping women, because there are people who have all of these issues that they're too afraid to talk about in a safe space, and then they lash out. Yeah. Those are the people who, like you say, they just aren't smart. Right. But it's not that they're not smart. It's just that. Well,
what I mean by not smart, I'm just saying, I'm coming from a place where I don't know, and if I don't know, first thing I'm going to assume is I'm not smart enough.
Now, you see, hopefully, if you're one of those people, for an example, hopefully, somebody will cross paths with you, who's going to have a little more knowledge, who's going to have a little more awareness, and who's going to be able to communicate in an effective way with you to get you, not to change your mind at the beginning, but to get you to start asking the questions. Is something wrong? Is something in my life? Do I need to change? You know what I mean? People like that, if you can get someone like that in your life, and if you have someone like that in your life who you believe could be able to give you that kind of comfort and that kind of assurance, where you could talk about things that you find that are maybe weaknesses or struggles, then that's the first step in getting help. Because from there, you have a chain. You know, you have a link to someone who can find other resources for you. You know, that's why I'm not a therapist, but all my clients, I make sure that they have therapists, and I make sure that the clients who I make sure I find out what's going on in their lives, because how can you help someone with their mental health when you don't understand what's going on in their life that's affecting their mental health? Right. You know? So always the beginnings, you need to have someone who's curious, and you need to have somebody who actually is curious about you and curious about your well-being. You know what I mean? And that's why, you know, it's very important for it's important.
Right. I understand. Yeah, it's important to have somebody close to you, and just
have somebody that you could be open with.
But sometimes it's not somebody close to you.
Okay.
It could be somebody, an acquaintance. But like he says, it has to be somebody that shows they care. You know, that it interests to know that you're okay.
So for the most part, you guys are saying when someone shows that they care, you should latch on to the person that cares. No, so don't latch.
Why would you latch? You see,
maybe I'm using the wrong
You see,
yeah.
But you see, that's the problem. It's not the problem. You're not the problem.
Yeah.
But there's a problem in that.
Right.
Because you say latch on. Why do we have to latch on someone when we're in a crisis? The song isn't lean on me. It's not latch on me. It's lean on me. You feel me?
Right.
In order for you to get something from someone, you don't have to latch yourself onto someone. That's the whole problem with people now.
Right.
And that's why we suffer so much.
Yeah.
Why?
Because you become dependent.
You become dependent.
Exactly.
The only reason why he's suffering because of his brother is because he was because he loved his brother, because he had a ties to his brother. It was taken away from him. That's when the issue comes. And the issue also comes when you have too much of a tie onto something, too much of a tie onto someone.
It's the same way as looking at an addiction.
Exactly.
You latch to a person is the same as you latch to drugs, alcohol.
And you never latch onto drugs and alcohol because of the drugs and alcohol. Other things in life make you use drugs and alcohol to deal ineffectively. Drugs is a very ineffective way to deal with your personal issues. Okay, there are many other things that can help with that, which you need to expand your mind on. I'm gonna leave that there.
Yeah, we're gonna leave that right. I know exactly. I'm with you. I'm gonna put it right there. My people know exactly what you're talking about. But that's the nonsense episode though. But yeah, I completely agree with you. The latching situation is very dangerous.
We want to latch. Why can't we just hold on?
But I get what you're saying, because it's like an addiction for an addiction. You know, you pretty much
change one vice addiction for another.
Can't change your own vice for another.
Nothing is gonna fill the void that you have when you lose something, when you lose someone. It's learning to adjust, learning to cope, learning to move forward. I lost my classes today.
I was ready to fight. so I go, I lost my glasses and I was ready to fight. So I don't even. This isn't. But what happened? Oh, my bad. I did that again. I'll cut it out. I'll cut it through. So right as we're about to go out, we're winding down here. So you went through the pain. You went through the and everything. You had your dad. You had the people that you needed around you. Kat, your other male friend. They brought you out of the storm. You said you started educating yourself a little bit more about it. You then, from there, decided to do better by yourself, and by doing good to yourself, you ended up healing slowly, right? Yeah. And you're telling us the process of healing is slow. and you can't attach yourself to something because you're healing. Right?
You should never attach yourself to anything other than being better.
The process to healing is individual.
Right.
Everybody, because you heal from different things,
but
in
at the
different
same
ways.
time, it's individual, but you still need some type of support system.
You need support, and you need to give yourself the slack.
Got it.
Of knowing that I don't know how I'm gonna go through it, but I'm gonna go through it.
And it isn't gonna happen overnight.
So it's more of a balancing act.
Yeah.
Where a man will have to almost release himself, allow himself to be vulnerable to a particular person or whatever. I would just say thing.
Allow themselves to be vulnerable.
Just allow themselves to be vulnerable and
to the right people.
Even like you said, to books.
And to books. Because if you are alone, because I do have some people that watch and they're alone. And they will even write and they're like, I'm alone and blah, blah, blah. And if you are alone, you always could escape into a book or two. I would always say escape into a book because it lets your imagination go wild.
Yeah.
And you could kind of like do that. If you start looking at videos and stuff like that, you pretty much got too much room for imagination there. That's me personally. I believe. Because, you see words, you pretty much let your brain go. You see a video, you can't really imagine anything. It's in front of you. So I always say, like, try to catch a book. If you are going through anything, and you could correct me if I'm wrong, if you are going through anything, according to these gentlemen, do not become a leech on someone else, right? Someone else's emotions and feelings and allow them to dictate your own.
You see, I have to say that I don't want to use those kinds of words because those kinds of words are kind of the problem as to why people don't want to talk. Because no, and really, you especially with children and stuff like that.
Okay.
Do you have children?
Yes, 3.
It's very, very important the way you word things, because you could be saying, you're saying, don't be a leech onto other people. That's not the most effective thing to say. The most effective thing to say would be, we need to learn how to, in a healthy way, depend on people. In a healthy way, reach out to people. Learn healthy ways to reach out to people for support. Instead of saying don't be a leech, because then because if somebody hears don't be a leech, they're gonna be like, oh my god, it's a negative connotation. It always has to be positive. You feel me?
Try to always keep it positive.
Especially with young people, like with teenagers or children, you always make sure that the words you use are positive. A leech is somebody that sucks nutrients out of the body. Nobody wants to be a leech, but you can reach out to share an experience with someone. And that's more proactive, and that helps you feel safe to open up.
And that's why he's the professional and I'm the podcaster. You see what I'm saying?
but you see the thing is that you're the podcaster because people maybe will never hear this, but they'll hear it on the podcast. They won't hear it in life because maybe someone will never tell that. But you're facilitating this. You feel me? If you didn't ask me the right kind of questions or say the right kind of things, I would never say this.
Right.
So you're just as much a part of the conversation of healing as I am.
You're creating awareness.
Thank you very much, guys. I didn't want to blow smoke with me, but thank you very much. But you're right. The wording. Now that I'm thinking about it, the wording is very important.
Words are very strong, very powerful.
I almost said it to myself in my head, and I was just like, oh, that was kind of. I'd have probably listened to this over later and be like, ugh, that was probably
definitely, yeah.
But yeah, definitely, it is the wording. And as a man, I do feel like and how you said in the beginning, the way you say things to another gentleman, or the way you say things to an ethnic gentleman, is very important, because our upbringing, because how we were taught how to be strong. All that plays in the factor of how you say something. So you're right, exactly. You shouldn't say shit like leech. Share the experience. All right.
Yeah, no one wants to be compared.
Nobody wants to be compared to a disgusting thing.
Somebody call me a leech, I'd be like,
that's definitely. I'm not the guy to talk to right now about that. But I appreciate you guys for coming on today. Thank you so much for sharing your experience and your knowledge. We got a part 2 coming up with you real quick. But I want to offer another day where we could chop it up again.
Anytime. I appreciate it.
Thank you again, fellas. Can you just one time let them know where to find you? If you want to shout out your social media or what you're doing, just let everybody know so they can find you.
It's easy. You guys can find me, via Cat on Facebook, Tito Rodriguez. Mm-hmm. If you want, I'll give you my email. You can put it on the site, whatever. Yeah, put it up. But just to let you know, I'm one of those people that, with what I've lived, I don't mind speaking to anybody. Anybody needs help. Anybody wants somebody that wants to talk about what they're feeling and not be judged. Mm-hmm. I'm here. Awesome.
And one more time, let them know where to find you.
Nice. I don't want anyone finding me. I have to finesse my social media accounts because this is my debut performance. But you could just reach out to Kat.
This is what we do. Where you you're at the place you work at? Do you guys like take in walk-ins or anything like that, or do you get like particular people?
So we're in a global pandemic and things have changed very much. But
we offer Zoom.
Yes, but you know what? If you would like to have a day or something where I could talk about different resources.
Yes.
I mean, I'm from New York City, but I could probably look at New Jersey resources for like recovery centers for different.
Yeah, we got people that listen to this
pandemic
all over.
Support, stuff like that, because it's very important. And all of that stuff is medical, and if it's medical, it's confidential. That means that no one needs to know about it. So if you think that there's a stigma, I don't want to go to the therapist, no one needs to know.
Nobody needs to know nothing. That's something. That's just something a lot of guys need to hear. No one needs to know.
You could be vulnerable in a safe haven.
Yeah. Like or. So I was about to say that, actually, get out my brain. So I was also you could start a little group. You know what I mean? Go put something online, like looking for a few guys. Come hang out with me, drink a beer.
To talk about your problems. To talk about shit things that upset you.
You'll be surprised. I was looking one up late. I know we got to close this out. I was looking one up, but you'll be surprised how there's some guy. People will just show up if you. I mean, what Kat likes to say, if you build it, they will come.
Yeah.
Yes, they will. Yeah. They will pop up if you ask them to. You know, you might get one day, nobody one day, and then
especially because
10 one day.
I have a question really quick.
Okay.
What is it about, like, so we were just saying right now while you guys were talking about starting a group. So we were just saying that women do that already.
Yeah.
What makes it so uncomfortable for men to just...
So we're going to have to answer that on the next episode.
Yeah.
All right. So thank you guys again for coming in. This was a lovely, important nonsense, a lovely series, male mental health. We're out.